Thanks everyone for joining. We're just going to wait a couple of minutes to give people a chance to log on before we get started. Okay, welcome everyone. We'll give some time for other people to trickle in, but we want to get started because we have a packed agenda today. My name is Olivia Velez. I'm one of the co-chairs of the Global Digital Health Network, and we're excited to welcome you to our October 2021 meeting. I'm going to pass it over to Bobby in a second, but I want to let you know that this week is the last week for early registration for the Global Digital Health Forum. So make sure that if you haven't registered already, that you register. We're really excited about our programming this year. And we're also excited about this webinar. It's part of our special series on data ethics. So I'm going to pass it over to Bobby.
Great. Thank you, Olivia, for that nice introduction. Good morning. Welcome, everyone. I am Bobby Jefferson, Chief Technology Officer for GAI. And so we have today a very informative webinar from 3 professionals. So we're going to set the framework around this, which is really about cybersecurity. So welcome. October is Cybersecurity Month. So you should be getting lots of trainings and lots of emails and access and trainings and guidelines around cybersecurity. So this is a very, very timely webinar, and I'd like to share with each of you. We have 3 expert speakers. So Mimi Stankovic, who's the Senior Digital Policy Specialist from DAI, Mandeep, who's a Director of Professional Services from ITC Secure and part of the Cyber Alliance to defend our healthcare, and then Clayton Sims, who is the Chief Technology Officer of Damagi. And we're really want to make this very interactive. So first, could each of you who are in attendance put your name, your location, and any of your interest in cyber, whether or not it's just to learn, you're an expert, that you want to you've got a specific problem, but those 3 things would be helpful. So, so I'll put my name into the chat, I'll put my location, and I'll put my interest in cyber as well. And we'll use that to try to keep this very interactive as much as possible. So that way we want to make this very relevant, this webinar relevant to you. Next slide, please. So just want to provide a little bit of background that at the upcoming Global Digital Network Conference, the forum, in December, which I hope all of you plan to attend, there's a session and a track around investing in people who defend our healthcare, and that's part of the forum. And to do that, we can use AI and cybersecurity and privacy to help defend the healthcare system. It's an important role right now. My goodness, cybersecurity, securing our data, but more importantly, knowing how to protect and defend the healthcare system, and especially during times of COVID, is very important. There have been recent cyber and ransomware attacks. And so we'll talk about some specific attacks that have happened both to WHO, within the US, in Ukraine. And, many of them are involved hospitals and clinics, the NHS, National Health Service in the UK. And why this is important is because hospitals and clinics depend on us as data experts to help defend the electronic medical records, the systems behind it. And so this has real patient impact when the systems aren't available, are being held for ransom. And the healthcare workers themselves need to help to defend and protect the system. So we need to immediately address this topic. There are some coming policy guidelines that are coming out, both from the donors and from others around cybersecurity and how to address that. And there's also issues around ethics and privacy. So how do we ensure in this new world of cyber ransoms and all these things that are going on, how to protect the privacy of patients as well. So I'm really pleased. We'll start off with one of the major policy experts, and that's Mimi. And let's turn it over to you, Mimi, for just give us a brief background and then your presentation. What I would encourage as Mimi's getting started, if you have questions for her, to please put them in the chat, and we'll make sure to address each of those. So I turn it over to you, Mimi.
Thank you, Bobby. So as Bobby mentioned, I serve as a senior digital policy specialist with the Center for Digital Acceleration at DAI. In the past, I have served as regulatory in emerging technologies regulatory specialist for the International Telecom Union, for the World Bank, for the International Finance Corporation. And today I'm going to be talking about data access, interoperability, quality, and bias as they relate to developing countries and development. The healthcare market globally, driven by AI, is expected to register an explosive compound annual growth rate of 40% through 2021. And what was once $600 million market in 2014 is expected to reach $6 billion US by 2021. So AI combined with robotics and the Internet of Medical Things could address healthcare problems and help developing countries in meeting their goals in health. AI, as we all know, is creating a seismic shift in the way people interact with technology, and if deployed ethically, it stands to help address critical global challenges and deliver considerable benefits to developing and least developed countries. Now, as we all know, the application of AI to healthcare can be used to aid in detecting health conditions early, deliver preventative services, optimize clinical decision-making, and discover new treatments and medications. AI can facilitate personalized healthcare and precision medicine, while simultaneously powering self-monitoring tools, applications, and trackers. And many benefits can be attributed to big data and artificial intelligence, as they potentially offer higher quality and a lower cost of care. And there have been instances of using AI, machine learning, and big data in the context of low and middle income countries. For instance, AI may be used to improve the detection of tuberculosis and a support system for interpreting staining images, or for scanning X-rays for the signs of the disease, or other diseases such as COVID-19. In Nigeria, for example, Ubenva is using signal processing and machine learning to improve the diagnosis of bird asphyxia in low resource settings. Researchers deployed AI to diagnose diabetic retinopathy in Zambia, which it showed significant and promising results when compared with human assessments. It showed clinically acceptable performance in detecting the disease. Now, even though artificial intelligence and big data can have a considerable positive impact on the healthcare system in low and middle income countries, they also come with certain caveats. AI deployment in healthcare has raised legitimate concerns and anxieties, especially in the context of developing countries. And first, the quality and availability of healthcare services in developing countries lag behind developed countries, and we all know this. This leads to disparate health outcomes. So according to the WHO, more than 40% of all countries have fewer than 10 medical doctors per 10,000 people, and over 55% have fewer than 40 nursing and midwifery professionals per 10,000 people. So only 1/3 to half of the global population could obtain essential health services as of 2017. Not having adequate digital and data infrastructure impedes the prospects of artificial intelligence in the healthcare settings of low and middle income countries. Now, second, the deployment of artificial intelligence in standard healthcare delivery and administration is still minimal. So there are difficulties in scaling up projects and questions about the quality of health data. And we should look at this from a holistic point of view. So not just the data privacy, but also access to data, access to good quality data, etc., and cybersecurity first and foremost. And then third, artificial intelligence can be used to accentuate existing inequalities and unwarranted variation in care. And this is related to AI bias and AI black boxes, and which I'm going to touch upon briefly later on. And fourth, AI and big data deployment in healthcare create a novel set of ethical challenges that must be identified and mitigated, since AI technology has tremendous capability to threaten patient preference, safety, and privacy. And this is the crux of it. For instance, machine learning algorithms might not provide equally accurate predictions of outcomes across race, gender, or socioeconomic status. And this is a huge problem. One example is facial recognition technologies that assist with identification, monitoring, and diagnosis. So these technologies are increasingly utilized in healthcare settings. In informed consent, if you're a medical professional, you need to get an informed consent from your patient, and informed consent will need to be obtained to collect and store patients' images and for the specific purposes for which these systems might analyze those images. Now, patients might not be aware that their images could be used to generate additionally clinically relevant information. So to summarize, the use of AI in healthcare in developing countries is related to the following key challenges, and I'm going to talk about these briefly: data access and interoperability, data quality, bias, and data ethics and privacy. So these are all, very important issues that we should be all aware of. So it's estimated, just to present the issue and how important it is. It is estimated that 2,340 exabytes of space are needed to store the total volume of global healthcare data that was produced by 2020. If these data were stacked on the top of each other, they would reach 82,000 miles high, or circle the Earth 3.2 times. So that's a lot. Now, data, as we know, is something that our artificial intelligence applications run on. So data fuel digital health and AI deployment in health. They are the basis of research and discovery of new treatments, empowering the personalization of medicines. Now, health data constitutes 30% of the globally stored data. So that's a huge percent. For health data to make decision-making of the healthcare professionals better, the data sets need to be more diverse and robust. However, data access and data quality barriers still prevent innovators and healthcare professionals from using data more efficiently and effectively in health. So now the COVID-19 crisis has exposed these data gaps even further. Often health data in developing countries are incomplete or of low quality. So, this coupled with cybersecurity and privacy issues complicates things enormously. This leads to inefficient allocation of resources, first and foremost. Health data sets are siloed and locked within institutions, and healthcare systems are grappling with linking different data sources and using the data for different purposes and for secondary research, for example. Now, interoperable and good quality health record data would inform better care delivery and support more significant national health research goals. So apart from data access, data interoperability, as I mentioned before, is another challenge. Health data sets are often not interoperable. They're not talking to each other and not portable among institutions. This leads to less diverse health data sets that might not represent the patient population at the national level. Moreover, interoperability and standardization affect the building of regional and global health data sets. And as we have seen with COVID-19 crisis, this is very important. Okay, so this is very important. And this impedes the deployment of AI and machine learning in healthcare settings, especially in the context of developing countries. Another challenge is that much of the healthcare data is unstructured, which impedes uniformly compiling and analyzing health data sets. The proliferation of wearables and digital health devices provides the ability to capture and leverage real-world data as a supplement to clinical data. And there are certain problems related to this, which I'm not going to go into detail right now. Now, I'm going to show you a figure. This is from the World Health Organization. As we could see, data tells a story about us all, individuals, communities, and countries. The better quality data and analysis we have, the better we can understand people and address their needs, and the better artificial intelligence and machine learning tools can be deployed in developing countries' context. This is why data is at the center of good informed decision-making at national level, at local level, and also at micro level when healthcare professionals are dealing with data and they are receiving input from artificial intelligence, from algorithms, basically. So as you can see, there is a huge variance in the amount of recent data across different indicators. And, you don't see this here, but the WHO the data shows that 100% of countries have recent underlying data to estimate air pollution, whereas only 9% have recent data for essential medicines that are available and affordable on a sustainable basis. So here we turn our focus to countries grouped by income level using World Bank classification to see what percentage of health-related SDGs have recent data. So there are two key takeaways. Firstly, most higher income countries have more recent data for the health-related indicators, clustering around 60 to 80%. Secondly, there are 35 countries where over half the indicators lack recent data. So this is something that we should, this is something that, you as healthcare professionals or, developing countries governments should be aware of. And, we should work on this so that, we can deploy artificial intelligence and machine learning in developing country settings. And then from here, we could talk about privacy, cybersecurity, et cetera, et cetera. Now, another set of challenges is related to data quality and bias. So one of the key impediments to the effective deployment of AI in healthcare is access to fair data. What does this mean? It means findable, accessible, interoperable, and reusable. In developing countries, this problem is exacerbated because data are not always digitized. If they're digitized, they're not accessible. If they're accessible, they're not with good quality. So, This could be further supplemented by organizational. So what can actually developing countries do is they should adhere to the FAIR principles first and foremost, and make sure that the data is collected ethically before. This is for the governments before they certify the healthcare model, AI model, as fit for the market. And then we can also see that this could be further supplemented by organizational quality assessment in pre-market checkpoints for private sector AI firms that work on AI solutions. Now, these conditions can signal to the industry that data integrity and ethical collection is of paramount importance to be eligible for the market, and lead to positive structural changes in how private sector firms that develop AI solutions function. Now, data representativeness is another problematic issue related to data quality. AI's output is shaped by the data that is fed into it. So if we have garbage in, we have garbage out. Computer-based recommendations are often taken at face value, assuming that whatever result an AI algorithm portrays is objective and impartial, which is not always the case. I call this artificial stupidity. Humans choose the data that goes into an algorithm, and these choices can embed human biases, which in turn might negatively impact underrepresented groups. And these are all, these might be in developed countries, but they come from developing countries too. And these biases might occur at any phase of AI development and deployment. Now, the most common source of bias is data that does not sufficiently represent the target population, which can have adverse implications for specific groups. And I want to raise awareness about this. So, for example, women and people of color are typically underrepresented in clinical trials. If algorithms that analyze skin images were trained on images of white patients and then are applied more broadly, they could potentially miss melanomas in people of color. Okay, so or the use of an algorithm designed to prioritize care for COVID-19 patients could put populations lacking access to COVID-19 testing at a disadvantage because the algorithm may fail to factor in their needs and characteristics if these populations were underrepresented in the training data for the AI tool.
Thank you, Maria. Yeah, could you begin to wrap up?
Yeah, sure. And I just wanted to briefly touch upon on data ethics and privacy, but since we're running out of time, these are issues that are kind of related to bias, I just wanted to highlight that whatever we do, we should ensure that AI-powered tools can be applied equally to different groups of people. We need to have diverse and robust sets coming from developing countries, and even if diverse data sets are generated, this might not translate into AI tools rolled out reliably in low-income countries. Another issue that I would like to highlight is the potential for sometimes private sector data capture. Now, should we or not give AI developers access to low-income countries' data? And this is where privacy and cybersecurity safeguards come into play. Okay, so if they have strong cybersecurity and privacy safeguards, then we can talk about this. The issue of health data monetization, I don't have a lot of time to discuss this, but this is also present, the private sector, and is related to private sector data capture. So I'm going to wrap up for the sake of time. Thank you for your attention.
Great. Thank you, Mimi. I appreciate that. And I have questions for you, but I'll say that for the end for your Q&A. I'd like to now transition to Mandeep. And again, Mandeep is part of the Defend Our Cyber Alliance. So Mandeep, over to you. Yep. And I think you're a new organization to many of the people on the webinar. So thank you for participating.
Thank you, Bobby. Just to double check, you can see my presentation.
Yes, I can.
Excellent, thank you. First of all, thank you everyone for taking the time to join us today, this morning. It's been really fascinating to hear firstly from Miriam around the kind of the opportunities and challenges around data and privacy and artificial intelligence. And also sort of notably from my perspective, it's fantastic to see such a diverse and international global sort of audience on this webinar, and sort of keen from seeing some of the comments in the chat to learn and understand how we can sort of work together as a community of health and cyber practitioners to protect patients, data, and the industry we operate within. So to start, my name is Mandeep Gosal. You heard from Bobby mention that I work for a company called ITC Secure, which is a cybersecurity company based in London. We have a small office in Washington, DC. And also ITC Secure is part of a much larger, wider consortium of cybersecurity companies within what we call the Cyber Alliance to defend healthcare. And I'll talk a little bit more about who we are and the work that we carry out to help support our healthcare industry, certainly within the context of the COVID-19 pandemic. Just moving to the first slide. So you probably think, well, why is Mandeep telling us about cyber risk? What is it? This is a very sort of basic question, we know, but fundamentally, I think we just need to remind ourselves about what cyber risk really is. You hear about cybersecurity, information security, cyber risk. Really, the advances in technology which are driving digital transformation, and we've certainly seen the pandemic massively accelerating, right? That digital transformation, which, quoting somebody like Satya Nadella, Microsoft, digital transformation, which would have taken companies 2 or 3 years, has happened in the space of a few months, certainly at the start of the pandemic and up to present day. So with that, with the trends of massive proliferation of e-commerce, mobile payments, moving data to the cloud, big data, artificial intelligence, all of these technologies, which are obviously great enablers for society and today's business. But with that comes a challenge with increasing the cyber risk that those businesses that are adopting these services and technologies are likely to face. And I'm sure you're hearing in the news and the media on a daily basis around phishing attacks, ransomware, state-sponsored sort of espionage, and very, very high-profile incidents in all of the regions around the world. So we know, without any question, this is a clear and pressing danger. But why is this a little bit of, I would say, more concern for the healthcare industry, based on some of the reasons Miriam mentioned for good, but also I'll talk to some of the more maybe fundamental reasons as to why the healthcare sector has to gear up and prepare to tackle this problem collectively. So just some of the reported examples of some of these breaches and attacks, and I pick my words very carefully here in terms of when I use the word reported. So a lot of these attacks are kind of happening on an hourly basis. They're just not potentially reported. Certainly some ransomware attacks, where obviously from a reputational perspective, businesses, hospitals, healthcare organizations may not want that information to appear in the public domain, whether they like it or not. But unfortunately, we have seen, the World Health Organization have around 25,000 email addresses, for example, including from the National Health Service in the UK, in the equivalent in the US being leaked. We have seen something called sort of kinetic cyber attacks, which when you take sort of financial services industry or other verticals where don't necessarily have a human at the end of the attack vector, then the worst that can happen potentially, maybe I'm generalizing here, is financial loss and reputational damage in the market. But when you're talking about hospitals, when you're talking about those organizations which are investing in research to develop vaccines for new novel viruses such as COVID-19, then there is a potential human element at the end of that attack chain, which is very serious for very obvious reasons. So we've got some examples here of US hospitals, which we've all heard of, being taken down to the point where ambulances, emergency vehicles have been turned away at the door of the hospital to reroute to another hospital in the next town or perhaps even in the next state. We've heard of, for example, I'm not going to read out every single one of these, but the University of Oxford in the UK, which was at the center of developing the Oxford AstraZeneca vaccination just over a year ago. Very, very obvious, very clear attempts from nation states and other attackers to gain access to that intellectual property, the kind of the secret source, the trade secrets, if you like, from those organizations that they use to create vaccines. So again, just some more clear and present examples that are reported in the media, but there is a whole lot happening sort of under the surface that isn't necessarily reported. So what does this actually mean in real terms for the healthcare sector? There's an increased threat landscape. So not just a single hospital or healthcare organization, the attack surface, if you like, which is the surface within an organization, maybe it's within the network infrastructure, whether that's individuals within that organizations, that can be bribed, or there is a disgruntled employee, or if it's a motivated nation state. The overall threat landscape for these organizations, specifically in the healthcare sector, is increasing in a great deal. So what does this actually mean? So, what are they trying to steal, and why are they trying to steal this information or use it for other nefarious means? Personally identifiable information exists within all industries, but specifically, obviously, in the healthcare sector, this is a great value. Not only can it be obviously sort of sold on the dark web to the highest bidder, but also from a research and development perspective, as I mentioned, in terms of vaccinations, also for other perhaps nation states trying to carry out sort of espionage or reconnaissance around what other countries and regions are doing from an intelligence gathering purpose, which we know with certain nation states is a clear strategy. Then that is a very attractive proposition when looking at the information and data available within healthcare databases, systems, infrastructures, etc. And what sort of exacerbates that issue within the healthcare sector is the network architecture of healthcare systems tend to be quite old at times. There's a legacy issue there, which I'll talk to in a minute, specifically is around sort of budgets and constraints specific to hospitals. Contain a large amount of IoT devices, operational technology to manage the IoT devices, medical devices. There's a lot of investment, as you heard Miriam talk about, from an AI perspective and from a tech perspective in these devices, which clinicians use, from a trust perspective. They have to rely on these devices to provide credible, trustable, verifiable data to make very accurate patient diagnoses. If the clinicians are now facing the prospect of that credibility being compromised, then that creates some very serious ramifications. And also it becomes, from the perspective of IoT, OT, legacy hardware and software, very, very difficult for hospitals to identify where those vulnerabilities exist within their systems and their infrastructures. So if you can't identify what's potentially going to hurt you, then you can't protect yourself from that vulnerability. So that's where we need to start thinking a little bit more collectively and working with organizations such as the Cyber Alliance for Healthcare, but many other organizations who are out there looking to help you manage that cyber risk I talked about. So who are we briefly? C5 Capital is a venture capitalist firm which owns ITC Secure, the company I work for, a managed security provider, and many other cyber companies, and has a large network of cybersecurity companies that C5 Capital have looked to convene, to bring together, to support the healthcare industry, in many cases free of charge, pro bono, offering service to initially advise, again, to help hospitals, healthcare organizations identify where those vulnerabilities are, to begin with, so understanding your security posture, what the risk appetite might be, where these ransomware attacks are likely to come from, what is the training, what is the status of the training program within your organization to make sure that your staff know what to do in the event of an incident, a breach, an attack, or just from a very basic perspective, have very strong passwords and understand where the risks are likely to come from, and also what to do about those legacy systems I mentioned. So all the way through that kind of stack of cybersecurity solutions, identification of vulnerabilities, training, and then providing very advanced technical solutions where appropriate to help mitigate those cyber risks. The Cyber Alliance for Healthcare was convened in March 2020, exactly at the time that the pandemic hit. So one of the founders of C5 Capital took the decision to create the Alliance and give back to the healthcare sector, whilst allowing the healthcare sector to take care of, obviously, patients and manage our way through this pandemic. So a number of sort of logos, brands that you can see on the screen here, with that increased threat landscape, so many different places across that attack surface where that threat could come from, needs a very different solution, which isn't just one single, as we saw it within the Alliance company or organization. It would be many, a collective defense of organizations which can provide niche and bespoke solutions depending on the nature of the threat that your organization is facing. So some of the names on this slide provide specific email security solutions, managed security solutions, more behavior analytics solutions, and so on, which we can go into in a little bit more detail if we have the time. So I'm just going to talk about two very specific scenarios for the healthcare sector. So you heard me talk about stricter budgets, more sort of reduced budgets in the sector for very understandable reasons. But because of those constrained budgets, it makes investing in those new tools and technologies and training programs all that more difficult. And obviously not without making that investment, and let alone not even identifying whether vulnerabilities may or may not exist, creates a little bit of a perfect storm of a problem. Fixing those legacy implementations, often we've found in the healthcare sector, results in very quick fix repairs, very point in time kind of workarounds, remediations that are put together, but that doesn't adequately address that risk overall. So again, identifying which legacy systems are vulnerable, not only in hardware, but also in software, where those software versions are unpatched or are left sort of unpatched for many years at times. For example, the WannaCry, you may have heard of ransomware attacks a number of years ago, was an example of a breach where organizations could not patch that vulnerability on their legacy software, which obviously created a very major global issue. Talking about the second and final scenario, just before I move into my summary, phishing attacks and resultant ransomware attacks. Somebody once described to me, and I kind of believe this, specific to the healthcare sector, a phishing attack is almost a perfect business model for these bad actors, if you like. Very low barrier to entry. The tools can be widely available and often leaked from government agencies that these criminals will use to, at the worst time, the best time for them, but the worst time for healthcare workers, at times of crisis, to send an email that looks like it's coming from a government body or high-ranking official in your organization. And with that, the kind of the end product, if you like, rather than it being a service or physical product, an individual, a human, means that healthcare employees are much more susceptible to these attacks. And from that perspective, it is a very dangerous business model, especially with phishing and ransomware in combination. Now, it's an important point to make. We often talk about technical solutions, and within the Alliance, we have very advanced technical solutions that we can provide. But that isn't the only way to reduce the cyber risk of phishing attacks actually succeeding, in tandem with making sure that your staff are empowered to really understand the role that they play in your organization's defenses, so that they are able to spot, for example, a phishing email, to spot when a ransomware attack might be being proliferated, understanding if a colleague maybe has access to systems they shouldn't have access to and potentially be sort of bribed or manipulated. So sort of that's those cyber hygiene factors and training and understanding within your organization, I believe are equally as important as any technical solution to help in reducing the risk of these phishing attacks succeeding. Finally, just to focus on sort of some of the mechanics of the Cyber Alliance for Healthcare. So you might be wondering, okay, well, Mandeep's talked a lot about some specific risks that maybe resonate with me, and I've suffered from one of these attacks, or I'm worrying that I might be suffering or about to be suffering from one of these attacks. Well, how can the Cyber Alliance for Healthcare actually help? So ITC Secure within that alliance is the rapid response consultancy arm, if you like, of the Cyber Alliance. So if you have an issue, a question, no matter how big and small, if you think, okay, well, there's a company there with a solution that makes sense for us, or I just don't know where to start, then you can contact myself. Our contact details or C5 Capital are available, and I can share those details. And what I will try to do with my team and working with the Cyber Alliance for Healthcare is map your question or your requirements or your cyber risk to some appropriate solutions and services offered by perhaps an individual company or individual consultant, or it may also be a mesh of alliance members and companies. So it will be, and often based on the terms of the service, that will be pro bono and free of charge. So a real compelling offer there to help organisations in need in the healthcare sector. And that's actually all of my slides for the moment and content. So I'll stop sharing there and I'll hand over to Bobby.
Great, thank you, Mandeep. That was very informative, and I'll definitely ask you a few questions at the end. So now I'd like to turn it over to Clayton, the Chief Technology Officer from Tamagi, to begin his presentation. And again, once again, if you have questions, please just drop them in the chat and we'll try to get them addressed. Thanks, Clayton.
Great, thanks, Bobby. And thanks to our other panelists. As Bobby introduced, my name is Clayton and I am the CTO over at Dimagi. And I'm hoping to give everybody here a little bit of a different perspective, maybe a more practical perspective, as I come from the implementation side of the coin too. For the last 10 years or so, I've led Dimagi's efforts on ComCare, which you're probably familiar with. It's a platform for building and deploying mobile apps that support health interventions in low resource settings. And for reference, over the last couple of years, we've had a global footprint of about 700,000 people using ComCare in about 80 countries across our cloud and on-prem deployments. So we have a pretty strong basis of experience here. And I was really excited to hear about this panel and hear about this opportunity to discuss with everybody here, because security and privacy issues have really been top of mind for us lately. We've recently completed our certification and our SOC 2 compliance audit. And it's funny because we've always put data privacy and security center stage as implementers, but it's always been really hard for us to figure out in the industry where to fit in terms of compliance and expectations with our partners and our customers, because our partners over the years have had really wildly different expectations in terms of what to expect from us, in terms of security capabilities and certifications to prove them and what expectations to have, right? And I'm gonna guess that that's probably something that's really similar for a lot of people in attendance here today. And it's easy to understand kind of why our industries don't exactly provide a lot of guidance on security and how to approach it. I'm sure that everybody here is familiar with the principles for digital development. For example, one of them is in fact, address data privacy and security. And if you dig into the details of that tenet, the principle provides with these 9 thoughtful tenets about data sovereignty and ownership and things like that, followed by one final 10th tenet, protect data. Which it's easy enough to say, right? And I understand, it's hard to be specific about security. I'd be the last person here to specify, say that we should be providing exhaustive lists of specifics about how to do that. That'll be out of date in a couple of years. But I think this really illustrates kind of the unwillingness of our industry to look the real security challenges that we have on the face head on. But history, thankfully, and Mandeep gave us some examples, can give us some better guidance, right? I'd love to talk about a couple of years ago, the UN had a major incident where something like 42 of their servers were compromised, including those in the Office of Human Rights, because I think we have a lot to learn from this example. And before I get into some of the details, I want to be super clear. I'm not here to throw shade on any organization with a major public profile that has security incidents, right? Pretending that good systems don't have security incidents is a huge fallacy. But the UN is a huge organization with access to resources far beyond what most individual health programs here do. So if protect data is hard for them, there must be lessons here for us from this, right? And in fact, the more I read about this specific example, the more familiar a lot of the details of the source of their problems seemed and seemed really relevant to us. So I think there's a lot to learn about where we need to be doing better here and what it looks like when we don't. And I want to start with the fact that the UN did not disclose the breach that they had. We would never have known that happened if somebody hadn't blown the whistle or leaked the information. And that means it's probably happening a lot more often than we think. And that might seem like shocking or scandalous, with GDPR and European privacy regulations, but it fits into a really uncomfortable pattern I think we all need to understand about our industry, which is that data privacy regulation is targeted at commercial entities in how it's structured and how it's executed. The incentives for responsible disclosure and management are much less strong than you might think. The UN didn't face any meaningful consequences from having this breach. And a lot of governments or public service agencies, they wouldn't have either. But whether we would have ever heard about this is the wrong question for us to ask anyway, right? We don't deserve a disclosure of this incident, but the people who participated in these programs, they do, right? I firmly believe individuals who are tracked in our systems, they deserve the opportunity to be notified if sensitive information about them is lost and what that information was, because otherwise they can't provide informed consent. Working backwards, that requires us to follow a lot of steps right though. We have to know whose data is in systems. We have to know how to reach out to them. You have to be able to see that improper access occurred. And you need clarity about what information was accessed. And kind of more importantly, you need to want to know these things. And we need to be honest that with the right justifications, most organizations, they'd probably rather not look, right? Being good at that process, it requires scenario planning backwards from failures and it's laborious, complicated work. And the incentive that organizations have to be good at that is to get visibility into the smallest scope of breaches, because otherwise they're accountable for assuming the worst case scenario. But it only matters if the worst case scenario has any consequences, right? I believe that the reason the UN didn't bother to report their breach is probably that they weren't able to inventory what was exfiltrated. Reportedly, they didn't actually have any insight as to what was gained out of this breach, merely that happened. And that's really common. You've probably gotten more than one email in the last 5 years with a blanket statement. Your data was on a server that was breached. We can't tell you whether your specific data was breached or even really what's in there, but good luck. Oh, and also we take security really seriously. But it's counterintuitive, but we should acknowledge most organizations, they have a perverse incentive to not know more, right? Bad responses here, they don't hurt them. They just hurt the people they're supposed to protect. And global goods implementers, our practitioners, we have an ethical obligation to hold ourselves to do better, right? To hold ourselves to a higher standard, because we're choosing to put ourselves in this game. And I think that means not demanding just that we protect data, but that we have a detailed plan to remediate and hold ourselves accountable for when we fail to protect it. Getting a little bit more into the details, of this breach, I think it provides another really critical lesson for everybody in the health industry, which is the need to factor in managing security and privacy as an ongoing permanent cost of our digital systems, not something we can just address up front. Because it can be really compelling for us to think of security as kind of an isolated property of our systems that protects us. Bad guys want to break in to our specific piece of software, and because we applied good security, they're unable to, right? So it's all the properties that donors and governments and people want, right? Security is a need, so we put a line in a contract for like some machine learning or something we put in front, and then we never need to pay out to think about it again, right? And the issue is that's not how any of this works, right? Security is a weakest link problem, and attackers don't just try our front door, they try all of our doors all at once. And more than that, they're not just trying our doors, right? They're trying our neighbor's front door to see if they can sneak in through the backyard. They're trying our car doors to see if we have the keys to our house in our glove box today. And that's exactly what happened to the UN, right? Attackers didn't break into a sensitive database, right? Attackers, they used an unrelated weakness in an unrelated server to break into the network, and then they escalated outwards until they had access to dozens of servers. And the weakness that they exploited, like Mandeep talked about, is the result of an unrelated piece of software where a mundane security patch hadn't been applied. That's what opened up this entire system. But before you jump in to blame whatever sysadmin hadn't gone around to do that update, I want you to keep in mind that this year alone, researchers have already published 16,000 new vulnerabilities into the CV database. Right, we need to be thinking of security not as a battle, but a siege that we have to win every day, but the bad guys only have to win once. And fighting that fight every day means that we have to pay for resources for every day, right? Whether it's our sysadmins patching wikis or licensed firewalls that update their own firmware, because security is an arms race where they discover new weapons constantly. And I think what we all probably don't realize, and what non-technical people really don't realize, is that the arms race isn't between us and the bad guys. Right? Because hackers, like the real hackers, they're not going out of their way to discover these increasingly complicated exploits to hack our sites. They're doing it because their real adversaries are these major commercial entities like Facebook and Google have these incredibly sophisticated teams of technologies backing their security teams full time. They're the real targets, right? One of the zero-day exploits that Google's security team found and fixed this year was about browsers loading multiple malicious audio files at the same time, triggering a memory exploit. That was a real attack that was being used by hackers in our media. If your people aren't doing that kind of work, we're not in the fight. We're collateral damage from that fight. Right? Because just like in the real Cold War, both sides on that fight, they're leaving behind their old weapons. And that means we have access to, from these companies, these incredibly sophisticated tools to protect ourselves. But the asymmetry here is problematic because it's always easier to attack than defend, right? The bad guys here, they get an exploit. They get like a piece of software code that's a heat-seeking rocket. They can pick up, aim, and fire and move on if it doesn't work. What we get as the good guys, we get a kit to build an expensive wall that needs daily upkeep that can only be built by someone with 5 years of construction experience, right? It's not that we don't have the tools, it's that with every passing day, the skills and resources that it's going to take to provide effective security are increasingly specialized to the point where even organizations with access to huge resources like the UN, they can struggle to leverage them. So for most organizations, for me, it's hard to see a way forward other than most people trying to stay out of that fight. Because one of the advantages of the tools that we do have available to us is that once we build those walls, there's actually a lot of room inside. I think our industry overestimates the economies of scale for software systems, but on the security side, the economics of multi-tenant scale, they're extremely compelling. If you tabulated the monthly cost for, the personnel and appliances and procedural investment that, it takes for us to run our own software system safely, you would think that it's impossible for anyone to run a software team safely for a project, but it's a baseline cost, right? 1,000 organizations leveraging that same infrastructure, all of a sudden you can afford to do quite a bit. And, I think everybody here, we're all in healthcare, we're all here in an impact space, we're here to make an impact, right? And that means building something big and something meaningful and something risky. So if you're here on this call to learn to build a better wall, my absolute sincere advice is do not, unless you absolutely have to, don't. Find someone who you can pay to stand behind the one they've spent 5 years building. Because they can tell you in Geneva that all those leftover heat-seeking missiles are very real, as are the consequences to people they're trying to serve. So thank you for your time and looking forward to some Q&A. Thanks.
Excellent, great. Thank you, Clay. And that was very informative, practical, and useful. So I do have a few questions we do have that I both put in the chat and that we've gotten. So the first question is around being targeted. I work in a rural clinic, rural hospital. I have low resources. Why would cyber attackers go after my rural clinic and hospital when I'm a low resource and infrastructure? And then the second part to that is, what do they use my patient data for? So, okay, financial data we understand, but healthcare data, what do they use it for? So I have at least those two questions. And let's start with Mandeep and then Clayton.
Sure. So it's an interesting question. So actually, within the Cyber Alliance for Healthcare, we did work with one quite small hospital in the Midwest with, I think they had 100 staff. And in terms of their operational security team, it was like one guy, maybe two guys in the team. We found when we ran a cyber assessment for that organization that they were actually being pinged or having attempted pings from a nation state and from many other sort of bad actors who shouldn't have had access to their network, which was actually quite surprising for them, but not so surprising for us. And I think maybe another way to answer that question is maybe some of the larger institutions with lots of infrastructure, lots of patients, lots of medical devices, perhaps, stand as a more attractive proposition to an attacker from a financial gains perspective, or a nation state from an intellectual property theft perspective. But, it's going to be those perhaps smaller organizations, hospitals, health organizations that think, we're safe. Why would they be interested in us? Where, actually, it's so back to that low, it's a perfect business model. It's very cheap or almost, free to get access to these tools. Then why wouldn't perpetrators look to target you? So, and also maybe not even an external threat. It might be that insider threat I kind of mentioned, or a disgruntled employee or somebody that's been bribed. It's just easy pickings, I think, is the answer to that question. So, you just got to sort of at least, take care of the basics. And it doesn't, I always say to my young daughter, manners don't cost anything. So, training your good manners don't cost anything. So training your staff to, use strong passwords, know what bad looks like, know what good looks like from attack vector, from a breach perspective, is quite a simple and I think an effective solution to put in place, even if you're not investing, with your potentially very limited budget in a very advanced technical solution. And why would a hacker be, interested in patient data? I think they're perhaps not interested in, why, John Doe has a tumor or something in the medical history. But obviously from a reputational perspective, and also from a holding that organization to ransom perspective, again, obviously that hospital doesn't want to be giving away, their patients very private and sensitive data about their health, the status of their health, would you? so obviously there is a use case there for hackers.
Clayton, I want to give you an opportunity.
Sure, yeah, absolutely.
How would hackers use patient data, and what's all the SOC 2 thing you keep referring to?
Thanks for the question, Bobby. I mean, I think it is a really important thing, I guess, for everyone to really kind of factor in where they fit into the threat model and what risks are faced by individual programs. I think, one thing that really probably isn't super clear to a lot of non-technical people I think, about the internet and about the way that kind of cybersecurity has evolved is that nobody's, with the exception of very, very, very specific people, like nation states, the CIA, Google, for the most part, hackers aren't really out looking to attack anyone in particular, right? When you're a hacker, your approach is a numbers game. You're not even really looking for organizations. You're literally looking for servers on the internet that are running certain pieces of software have exploitations and vulnerabilities. You're looking to break into them, and then you'll figure out what to do once you get there, right? There are targeted attacks. There are people who are trying to look into specific networks, but for the most part, organizations don't need to be afraid that they're getting targeted attacks from nation state actors. You need to be afraid that someone who's trolling the internet looking for an unpatched wiki they can break into to get root access so that they can then see what else is on your network, they're going to find that you're hosting something that's out of date. And going back to your question about SOC 2, Bobby, I think so SOC 2 is an industry standard for security and compliance auditing. And I think one thing that you really learn over and over from going through that process, even if you knew it before, is that security really is a very mundane thing on a day-to-day basis, right? Most of security is very rote process for making sure that you've covered up every single hole in your ship. Needles punch through, like your out-of-date wiki, your out-of-date, SharePoint server. Like those are the things that actually end up coming into problems. So, we expect to work with auditors, and they want to look at our in-depth security. They want to look at like all these super special things that we do for our users, and they're like, no, we want to see that you have a ticket every time you get an automated alert from your threat detection system, and that somebody followed up with it a certain amount of time, right? And I think that's exactly the kind of thing that we need to be making sure that we're thinking through when we think about threats. And the internet isn't this really scary, huge, big thing. It's the mundane, very, very, very scary thing of everyone trying to attack us all the time and needing to be ready 24/7.
Great, very interesting. Thank you. Mimi, you mentioned about AI and machine learning and all these very sophisticated, approaches. But if I work in a low resource clinic or hospital or setting, how do I take advantage of that? How do I use that? Are there any innovative mechanisms or way? I'm offline. I'm not very sophisticated. I've got maybe some cloud-based type solutions, maybe some mobile. What has been your experience? Sorry, you're on mute.
So I'm a policy advisor, so I work with governments. You mentioned, what would be, for example, the importance and significance of a rural hospital, having all these data. Actually, a lot of governments are running these e-health national programs. Okay, so they are putting data from hospitals into the cloud, and then they have, and a lot of health data, actually often health data in developing countries, in low and middle income countries, is government owned. Okay, so they put it on into the cloud, and then there you go. Then you have the cybersecurity and privacy issues are being scaled up at national level. So perhaps at a local micro level, this is not important, but at national level, when all these data is uploaded into the cloud and it's just there, then this becomes threatening. You mentioned, Bobby, the case of Ukraine. I work with the government of Ukraine, so I know that they have this e-health initiative, and then a lot of patients in a lot of hospitals are uploading their personal data into the cloud, and then these issues are being scaled up. So we really need to raise awareness at personal, at micro, local, and regional and national level about the importance of cybersecurity and privacy of healthcare data, because there are these health initiatives at national level, and we need to be aware of those. So it's not micro only, it's also regional and national level. Thank you.
Thank you for that, Mimi. I appreciate that. So we are now completed our webinar, and I want to invite you. I know you have questions as well. Please be able to. We'll follow up with the panelists, and then at the Global Digital Forum, we'll hold a session on cybersecurity. So this is just the premiere to that large plenary session where we'll talk more about cyber. So just wanted to let you know that. So now I hand it over to Olivia to wrap this up. But thank you all of you for participating.
Thank you, everybody, for coming today. And please feel free to sign up for our Global Digital Health Forum and for our mailing list. You can also follow up with questions on there if you're unable to make the plenary, there's another place to ask questions, and we'll be posting the recording of the webinar in the next few days, so you can catch up on anything you missed and share with your colleagues. Thanks for coming, and take care, everyone. We'll see you next month.
Thank you.
Thank you. Bye-bye.